Oh my God.
Home runs. So what we're gonna do, Kurt, you're here for a few things.
Yeah.
First thing we're gonna do is I'm gonna watch you walk. After the walk, we're gonna get into the exam, and then we'll go from there, okay?
Sure.
Go ahead and watch and walk for us, please. And you're gonna walk a straight line back and forth.
So should I go backwards or?
Turn around and walk this way. Good. And your normal walk. Don't think too much about it. Just walk towards the wall there. So what I want you to notice in his walk is as he's walking, if we look at his feet, he walks on the outside left heel first more. That outside back left heel. So he's catching those heels with slight supination. You walk like this. It opens when you walk. Okay, keep walking, please. Now let's focus on his back. As he's walking, you can see there's a little bit of stiffness in that low back when he walks. We don't see a fluid. What's that?
I'm actually in pain here right now.
You're in pain at the moment on the right side, yes?
Yes.
Okay. Now, let's do this. Let's just stand in the middle of the room, right there, and let's march in place. Just march like this. Okay? Now, look straight ahead. As you're marching, close your eyes. Now, what we'll notice as he's marching, he'll love balance. He's going away from me now. He's catching himself, but he's still starting to move a little bit off. Open your eyes, keep marching. Where's the pain right now?
I'm different here.
You see that,
Yeah,
right?
yeah.
Okay. So one is you're starting to move because of the foundation. It's off just a little bit. More importantly is where's the pain right now?
Here. Over here.
Is it shooting down or is it localized?
No, it's actually like going this way. Not all the way down, but more like something here.
Back hamstring?
Yeah.
Okay.
Right where you said.
Okay, keep walking, please. Go back over here. And let's focus on the dimples here. Let's see what's going on. Go ahead and walk. So you can see a little bit of that side wiggle. You got a little bit of that wiggle, okay? A little bit of that side wiggle on the left side.
Actually, there was once I was carrying a bag, and you know how a bag can touch this area?
Yes.
And I feel like there is a bone poking out more than the other, and I feel like the bag is not like balanced on my back. I feel like there's, I don't know, something over here. Like
You are carrying a bag on your back.
Yeah.
Got it, okay.
Like a backpack, basically.
Yes, okay. Keep marching, please. Now let's watch his shoulders. So he wants to go to the left side, okay? He wants to go to the left, but because of the short leg on the right, he's catching himself. So watch, he goes to the left, he drops on the right. You feel that, right? Okay. Now let's get an overall appearance of his spine. What's the first thing we notice? This is your normal sitting at the moment, correct?
Yes.
Okay. So we can see this is a little bit asymmetrical here. This one looks more pronounced. It's not that he's fat here, excuse my terminology, or that he has a love handle. It's because of the curvature of the spine. It looks like these curves are different. Okay? They're very different. When we look here, they look even, the scapula, but this one looks more lateral. This one looks more centered. So here are my fingers. I'm on the medial borders of the scapula. Left is more symmetrical towards the center. This one is out to the right, okay? Posterior lateral forward, and that's what we were talking about. The right shoulder is higher, the left shoulder is lower. When we look at it, don't move. You can see he's kind of turned. His left ear goes forward, right ear comes back. So there's a lot of asymmetries. There's a lot of asymmetries in the body. And now let's figure out where these nerve pressures are that are causing them, okay? Starting at the base of the neck, let's run the meter up the spine. And the first thing we're getting is 20 points on the left atlas. 20 points left atlas is where we start. 5 points T2. Now, 12 points, T6, 7. Remember we were talking about that area earlier? Yep. Now, as we... But there's no nerve pressure. This is compensation. And you've had this for a while, Kareem, okay? This isn't something that happened a year, 2 years ago. You've been dealing with this for a while. All starting down, S3, S4, T7, T2, left atlas. Let's go ahead and check your pelvis now. Open and close the knees. We're checking the movement of the sacroiliac joints. Right side only. And when he does that right, that whole left is shifting. Do the left side. But when he does the left, right is also shifting, not as much. You can see all this puffiness in the sacrum. Both are kind of fixated. It feels more like a sacrum issue, but we will need to address the pelvis. Scoot back for me, please. Cool. Back towards me. This is your L5. S1.
Ooh,
tender.
Yeah, it's big.
Hold on. S2. That's where I'm feeling it start. You feel this one too?
Oh yeah. Oh,
this
yeah.
one is more tender, S1, or this one over here? That's what I feel. Yes?
Yeah.
Now, this L5 is where that spina, this is tender, yes?
Yeah.
Okay. But there's no nerve pressure here.
No.
Okay.
It is tender, but you don't feel like that electricity coming.
Good. Head down, please. Round your back. Let's statically palpate and feel. All right. As we get to right about here, it starts to change an orange peel. Right there. Head down. Round your back. More tender there. No, right there.
Ooh, yeah.
Yes?
Yeah.
1, 2, 3, 4, 5. Number 6. 6, S3. How many doctors do you think you've seen?
I've seen many doctors, but none under, like, they don't get it.
They don't get what? I don't understand.
They don't get my issue. They would tell me sometimes it's a muscle problem, sometimes they would tell me it's a bone problem, but no one told me it's a spine and joint.
Interesting. Okay.
I mean, I remember when I was 18, I literally couldn't walk for a week, and I went to I don't know how many doctors.
And where was this? Where was that?
I was in Saudi Arabia, back when I used to live there.
Tender there more or there more?
There.
Top
the
one?
second, no, the lower one.
This one.
Yep.
Okay. 7. 1, 2, T3. Now, T3 and T6 are a little close together for me to adjust both of them. I feel safer adjusting your T6, atlas, and sacrum to start.
Yeah.
Okay. Let's go over here to your x-ray and let me explain what's going on. This is your full spine x-ray. This is your looking at you from behind. This is right. This is left. This is your side profile. So first off, looking at it, we mentioned a few things, right? And let's go over it. We know we can see the pelvis or the foundation is off balance, right? You can see this hip or this ilium, this innominate bone is a lot wider than this one. You can see the right leg is slightly shorter on that right side. It curves, there's a slight curvature to the left, comes back to balance, goes straight up, and then right around here it kinks, the whole spine kinks to the left side, okay? Now, I want to go a little deeper into this foundation, into this pelvis, and talk about what's going on here, okay? Now, this just doesn't look right in here, okay, when we're looking at this. And what do I mean by that? It doesn't look right. If we look at the way your sacrum, you're young enough, okay, where, for example, when we look at your hip sockets, why is this one so much thinner compared to this one? And let's look at the sacrum. When we're looking at the sacrum here, you can it should be a. Well, we don't want the ilium to fall out now, do we? That was actually pretty funny. Seriously, dude?
That's how I feel about my back.
That's how you feel right now? Okay. So we want to see a symmetrical triangle of the sacrum, right? What do we see here? We can see it kind of kinks like there was a fall here. Then we have spina bifida here, S1 and L5. And what is spina bifida? It's non-union of the spinous or the tubercle. This is during embryological development, folic acid deficiency of mom. And you can see here the non-union. This formed, but didn't form as well as it should. All of this though, at L5S1, this is not where we're working on. We're starting down low of where this kink is actually starting from, okay? And so that's one thing. We need to work on the sacrum and the foundation. Let's look at the numbers of the foundation and see what this means. Now, we've talked a lot about in these videos about the leg length inequality. This is the foundation of the building. We need to have a level base and foundation. We have 7 millimeter short leg on the right. Now, here's the challenge, okay? The challenge here is figuring out where is this actually coming from and knowing that there are certain things we're not going to be able to do in your case. As an example, even with a short leg, that's fine. The rotated sacrum is on the left side, okay? Rotated sacrum is on the left side. The short leg is on the right. Anything under 7 adjustments will hold. Now, here's the thing. You have an EX 2.45. There's no discrepancy between left and right ilium in terms of PI or AS. So we may be able to get this up with the adjustment, but here's the other thing. A heel lift is actually not indicated in your case, and this is why. And this is in the Gonstead chapters. Your lumbar body rotation and curvature goes away from the short leg. So if we put a heel lift on you, it's going to make this worse. So this is a good example of why or when not to use a heel lift in a short leg. That's not your case. Your case is going to be, it's somewhere in the sacrum, okay? And then there's one last piece of the puzzle here. So even though this kinks, T2 is a side slip. That was another issue.
Oh, yeah, I see.
Okay? And whatever I'm explaining, you've heard me say this in the videos, right? So we have a T2 side slip also. Okay? It is what it is. Let's continue. Let's go to the side profile. Now, when we did the lateral plumb line, and let's look at the sacrum. This is how I know we had some trauma, so you need to go back and figure that part out. Well, whether you do or not, it's there, we're gonna deal with it. Okay? Whatever it is. Let's look at the sacrum. And when I'm looking at the sacrum here, we can see this just looks like there was a callus, there was a fall. It should be a smooth arc, and we can see all these little bumps here. More importantly is, this is S1, S2, S3. Also, when we were looking at the AP film, we saw a spina bifida, right? So it's not forming, something is different in size. All right, all that said, let's get started. So we're looking at sacrum, S3. We're looking at T6, but we're gonna start everything on C1. C1 left. So I'm safe today adjusting C1, S3. Have you walk and then recheck the mid back.
Okay.
Fair enough?
Fair enough.
Let's do it. So, left hand here. Here. Left hand only, right hand down. C1. You got quick reflexes, my brother. That wasn't it. Feet out, resting on your heels. All the way out, palms up. There we go. And let that left ear fall. Wow. Look up. There you go. Gotcha. Pull on this side.
Feels so good.
Face on over here. Good?
Yes.
L5, tender, spina bifida. S1, tender. 2, that's where we're going to be. S3. So, let's go up. You ready? Good. Chin up, look up. Hold him a little bit. Oh. Dude, you're quick. Oh. Gotcha. Let's walk it off a little bit, please.
Went to the left now. Was on the right, now it's on the left.
What's that?
Actually, no. Wait.
Just walk it up. Walk it up. Keep walking. Keep walking. Keep walking. And then we're going to go on the side and do the rotational part of that sacrum a little bit more, okay?
Yeah.
Let's go. We have left rotation, so go right side down over here, please. Just hold your wrist. There you go. There we go. All good? Let it roll slowly. Oh, you're quick, dude. You're probably the quickest patient I've had.
I have no idea how I do it. It's
You got some pretty quick reflexes. Let it roll. Let it roll. Come on. Breathe in. See, look at you. No, 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 no. Let it roll. Roll forward. Gotcha! That's the home run. Stand up and walk it off. Good stuff. Good stuff. Keep walking. Swing your arms, please. Okay, have a seat back over here. Let me run the meter again. Head down. Neck is clear, top. T2 is not there, but this one is still there, 6. Relax the shoulders down. Relax the shoulders down. Khalas. As you're walking, tell me if anything is different. So the first thing is your pelvis. Your pelvis is moving different.
Mm-hmm. I also feel more like upright. I feel like my shoulders are less heavy even for some reason.
Pretty cool, huh? Keep walking. Have a seat. The sitting is totally different now. Starting at the base, still should be clear up top. Neck is clear. I'm gonna wait on this one, this T2, okay? T3, we're not ready just yet. This is still a tiny bit. The back is clear. So the more you walk, the more this is going to unravel and balance itself out. I don't want to mess with anything else there. All right. Let's continue on the rest now, okay? Ears, shoulders, over, around, down, over, around. There you go. On your back, please. I'm going to start on your ankles. Raise your left leg. Stand up for me, please. Squeeze my hand. Squeeze hard. Squeeze. Squeeze and hold. Okay, we need to do the radial head. Distal. Breathe in. Come on. There you go. Breathe. Distal radius. Posterior lunate. You gotta breathe. Dirty.
Did
Feel like that 5 times now. Squeeze hard. Squeeze. You do feel that now.
Yeah.
Squeeze. Squeeze. Okay.
How many people squeezed your hand like
Too many people squeeze my hand. Go on your back. Last thing is the nose. Chin down. You can see the deviation like this. But more importantly is that it's affecting his breathing, correct?
Yes.
Okay. I'm here on the septum.
Oh my God.
Home runs. Breathe.
Voila.
Voila! Squeeze my hand. Solid. Squeeze. Welcome to the office, sir.
Awesome.
Okay?